Good evening, everyone. So I am going to go ahead and share my screen. Thank you so much for joining us this evening. I am Dr. Kimberly Smith-Dotrieve, coming to you live from St. Martinville, Louisiana, a little bitty old town, and I am glad to be here. I'm glad to be a part of the Wakana family. This has been a very, very wonderful journey for me and all of our distributors here. So I am going to talk to you tonight about CBD and seizure disorders. And so pretty much you're going to see towards the end that there's actually a true prescription CBD. And I want to make sure everyone understands, where our CBD stands when it compares to the prescription version, and how our CBD can actually be helpful, and how I've seen it be helpful in patients that I'm treating currently. So to get started, we want to talk about what seizures are. So when you think about seizures, I want you to think about actually this first picture here. You see how you see the brain and you see all the lightning happening. Have that visual when you think about seizure disorders. We have a bunch of neurons that are within our brain, and these neurons become hyperexcited. When they're hyperexcited, that is what causes people to start having seizures. Because if you think about the neuron controlling, let's say, the arm, it goes down, and it's part of that nerve that's controlling the arm. If it's extra super hyper excited, then we don't have any control over it. It's just doing what it wants. It's performing how it wants, whether that's just being completely still and the person's not able to move at all, or tonic-clonic, where there are a lot of jerks going on, which is how most people see seizures. But regardless of how it presents, seizures themselves are the hyper-excited neurons that are happening within the brain. And so we actually have three main different types of seizures. We have focal seizures with awareness, focal seizures without awareness, and then we have generalized seizures. And so starting off with the focal seizures with and without awareness, pretty much with awareness, of course, the person is aware that the seizure is occurring. Without awareness, there's some type of loss of consciousness along the way, or loss of awareness along the way. All of these seizures, though, they may or may not start with something called an aura. And an aura is a feeling, a sensation, the way a person starts to feel before the seizure happens. So not everybody has an aura, though. With focal seizures, there may or may not be an aura. With focal seizures, there's usually a focal part of the brain that is affected, which is hence the name focal seizures. So only a focal part of the brain is affected, and symptoms are dependent upon what part of the brain is affected. And we'll see more of that in a little bit. And most of the seizures are going to end post-ictally, which is how a person is recovering after they've had the seizure event. Some people will recover, go right back to their baseline without skipping a beat. But there are others who are going to have some persistent symptoms. And when I talk about the focal part of the brain determining the symptoms, let's say it's a motor part of the brain and it causes the arm to convulse violently. Symptoms that might persist afterwards is lack of use of inability to use that arm. The arm might feel weak. It might even look as though that person has a stroke, but the sensation comes back, the motor function comes back eventually. And normally that happens over the course of anywhere from 5 minutes all the way up to maybe 45 minutes. It just depends on the person. So when we look at the focal part of the brain that could be affected, when we look at this back part of the brain here in the red, which is the occipital region, that affects our vision. So if the focal seizure is starting back here, the person might start having vision changes. They might see flashing lights before their eyes. They may lose their vision. They may lose part of their vision. If it involves the parietal part of the brain, which is right up in this area, they may lose their ability to know where they are in space. So the spatial perception is lost. So that means there might be some imbalance going on. They may be ataxic, like moving, bumping into things. If it involves the cortex that involves motor function, then typically you're going to have some jerking, some convulsions that are happening there. And it depends on the part of the brain that's affected, whether if it's on the right side of the brain, normally the left side of the body is going to have the jerking. If it's on the left side, the right side will have the jerking. And that's just because of the way our nerves are, how they get into our brain. They start off on, their respective sides, but when they reach the brainstem, our nerves actually cross over, which is why you'll hear very frequently when it comes to stroke patients, how they might have a stroke on the right side of the brain, the right side of the brain, but the left side is functionally affected. So with seizure disorder, it's the same thing. If the right side of the brain is affected, it'll cause jerking on the left when you think about the motor function. And the frontal lobe, the front part, that controls our speech. So if there's a focal seizure with the frontal lobe, then the person's speech will be affected. So here are some different ways that people experience auras. Some people will have a certain smell, some people will have a certain sensation, a certain feeling, some people will have some dizziness, some drooling, some will start smacking their lips. But the aura, remember, this is what's happening right before the actual seizure takes place, is something that that person feels that lets them know a seizure is about to happen. But remember, not every person who has seizures experiences an aura. Now, focal seizures with impaired awareness, these are the most common forms of seizures. And that awareness, that loss of awareness can happen right from the very beginning, or it can happen as the seizure starts to progress. But pretty much the person can appear to be awake, their eyes may still be open, but they are not able to communicate, and they're not really aware of you trying to talk to them and trying to communicate with them. Now, generalized seizures are the third type of seizure. And generalized seizures actually have 4 stages. You'll get first the aura stage, where they're having the sensation that something is about to happen. So here you have hallucinations, dizziness, numbness, distorted emotions, confusions. Any of those things can start to happen before the actual seizure happens. The next thing that happens is the tonic stage. And normally with the tonic stage, there is a sudden loss of consciousness. The body goes really stiff, and every muscle in the body is going to be stiff during this tonic stage. The person might cry out before they fall and lose their consciousness. They may have some incontinence that happens, so they may urinate on themselves. The tonic stage is then followed by the clonic stage, and that's when you see the convulsions, the jerking, foaming at the mouth. That's when the person is more likely to bite their tongue. And the myth that somebody can swallow their tongue is just that. It is a myth. That is not a possibility, but they can bite their tongue during a seizure. And then the last part is the post-ictal stage, when they're recovering. The jerking, the convulsion has stopped, but the post-ictal stage typically leaves the person feeling worn out. If you can only imagine, their muscles have been through the wire. They've been jerking, and they've been probably stressed out to their max. And now they're in the recovery stage. So they're going to feel weak. They're going to feel exhausted. They're going to feel sore. Most of these patients are going to have significant drowsiness, probably go and sleep, take a nap until they fully recover. So what causes seizures to happen? Anything involving brain injury. If you have a concussion, if you have a head contusion, having a stroke, or having a bleed in the brain, anything that can cause brain injury can cause seizures to occur later on. Lack of adequate oxygen to the brain can cause seizures. Infection can cause seizures. Having a high blood sugar or a low blood sugar. Electrolyte abnormalities where the sodium or magnesium or calcium is too low. Kidney failure, thyroid disorders, and of course, drug usage, drug intoxication, or even withdrawals. There is something called DTs when it comes to alcohol. We call them delirium tremors. And it is actually a very dangerous thing for people who are alcoholics. Because if you just suddenly take away alcohol from them, their body, which has become dependent on it, will go through these withdrawals. They get the tremors, which typically will lead to full-on seizures happening, and it can be life-threatening. So diagnosing seizures, we go through the typical run-of-the-mill. We want to examine the patient. We want to find out exactly what happened. We want to get their history, especially their social history. What kind of alcohol usage have you been, dealing with, or drug usage? We want to do blood work. But ultimately, we want to get to the point where we are doing some imaging or some actual testing, like the EEG, which is going to be the mainstay. And the EEG is looking at the electrical activity that's taking place in the brain. Now, that is going to be something that has to be done. Sometimes we can do an EEG immediately, but most times when a person has a seizure for the first time, an EEG will usually be done as an outpatient. Patients are taken to the hospital initially, they are stabilized, and depending on whether or not it's the first or second or third seizure, medication may or may not be started. Usually if it's the first seizure, it's not going to be started because we need to see, was this just caused by something that happened at that moment in time, or is this something that's going to be ongoing? Well, the EEG can let us know. When you look at an electroencephalography or I am so sorry, electroencephalogram, you can actually see seizure activity happening. You can see excited neurons within the brain. The problem is sometimes you see it and sometimes you don't. So it's a better thing to be able to do it as an outpatient because neurologists are able to try and provoke seizures to happen. The best way is lack of adequate sleep. If you know anyone who has seizures, you know that if they have periods of time when they're not getting enough sleep, they usually will be provoked into a seizure. So sleeping is a very, very important part of preventing seizures from happening or keeping them from happening too often. Other ways that we can try and diagnose or actually rule out other things would be lumbar puncture, which is when you put, the needle in the lower part of the spine and you get some of the spinal fluid to see if there's something going on, and CT and MRI to look for masses that might be causing the seizure to happen. But ultimately, true seizure activity can be seen only with an EEG, and the neurologist is the specialist that will perform that test to see what kind of activity is going on. So if the initial EEG is showing that there is no seizure activity, then typically what will happen is the neurologist will have that person go back again and maybe stay for an extended period of time, maybe over a 3 to 5 day period or 3 to 5 night period. And during that time, the person they're kept awake, and they try to keep them awake for more than 24 hours if possible, sometimes up to 48, trying to induce a seizure to happen to see exactly what type of seizure activity it is it focal or not, and just how significant it could be. Treatment. So treatment, of course, we have anti-seizure medication. The common names you might know of: Dilantin, carbamazepine, Tegretol, phenobarbital, and good old Epidiolex, which is the CBD that is the only prescription CBD that we have right now. Mechanism of action involves the sodium channels, calcium channels, and GABA activity. And these are channels that are located within the synapses. Remember, we talked about this some time ago when you have neurons. So you have a series of neurons that are kind of lined up one after the other. The space between the neurons is that synaptic space. And sodium, calcium, and the GABA, which are very important to those synaptic spaces, whether those are inhibited or allowed to flourish, that can determine whether a person is going to be more prone to seizure activities or not. So if we can manipulate those channels and prevent the inhibition of these channels, then we can prevent seizures from happening. And that's what we get from the anti-seizure medication. The problem is the complications. Most patients have to be watched pretty closely. So if you're anyone on this call who has had any loved one, or if you yourself are dealing with seizures, please do not allow doctors to do blood work on you once a year. You need blood work every 3 months. Why? Because bone marrow suppression is a huge complication when it comes to seizure medication. Our cells, our red blood cells, our infection cells, our platelets, these are all going to start off in the bone marrow. That is where they are produced. And if we have bone marrow suppression, then you're going to have those cells in low quantities, which could be horrible for us. Also, we can get complications such as irregular heart rhythms, ataxia or imbalance, drowsiness, slurred speech, or liver toxicity. So anti-seizure medicines are necessary when you have someone who is having seizure after seizure after seizure, because every time somebody has a seizure, they are at risk of having some type of brain injury that ends up being pretty permanent after that. So we want as few seizures as possible, but we want to do it in the safest way. For some people, they have to, of course, do anti-seizure medication. If you have to do anti-seizure medication, that's okay. You just need to make sure that you are being followed by a physician who is going to do the proper blood work on you every 3 months to make sure that there are no other complications that are taking place as a result of that treatment. Now, when we think about the role of CBD and seizures, it is actually affecting the GABA activity. So the GABA, which is gamma aminobutyric acid, it's actually responsible for inhibiting convulsions. It works at the postsynaptic area, which is at the end of the neuron, but it works in that area by binding to their receptors, and it prevents convulsions. Well, this is the same when we're thinking about CBD. CBD is actually working on the GABA activity to make sure that we have enough of the GABA available to inhibit the convulsions. So the role of CBD actually, when we're talking about seizure activity, is in maintaining the neurotransmitter GABA so that the GABA can do its job in preventing convulsions from happening. So why do you think, I guess, why not Epidiolex? Why talk about what kind of CBD? Well, pricing. a big issue that we have in America these days is that patients are not able to afford medication that they need. So while Epidolax is a very good possibility for treatment, who can afford it when it costs this much money? So I wanted to show you this because the Epidiolex is actually, you get it in 100 milligrams per ml. And if you look at a 150-pound person who needs the average dose of Epidiolex, which is 5 milligrams per kilogram. So 150 pounds ends up being about 68 kilograms. And if you multiply 5 times 68, and having to do that twice a day, that ends up being about 681 milligrams a day. Now, 60 mLs is priced at $982. That is crazy. And it's the same issue that we have when it comes to insulin. We had it initially set up where everybody across the board could get insulin for $35, and that actually I think was revoked with whatever just kind of went on with in Congress maybe last month or so. So we still are suffering significantly when it comes to pricing medications, when it comes to patients being able to afford what they're needing for their different medical issues. And it's not any different with the Epidiolex. So like I said, not affordable. However, I have plenty of patients and actually even family members who are trying the CBD and who have noticed significant improvement in the frequency of their seizure activity. And while we don't have enough human studies as it relates to CBD, we do know that cause and effect can be a perfect educator for us. If I am giving someone CBD products, specifically what kind of CBD products are the only ones that I use, and they have been having 10 seizures a week. They start the Wakana CBD and now they're down to 1 or 2 seizures a week, or 1 or 2 seizures every couple of weeks. Well, I have my own study within my own office showing that this CBD can be effective. Now, by no means am I telling any of you who are not my patients specifically to just switch, get off of your seizure medication and start CBD, but I do highly suggest that you have a sit-down conversation with your physician. The reason is there are so many other health benefits that we can get from CBD. When I think about CBD, I think about it as a universal, like a Pac-Man for our body, actually. If you think about Pac-Man, I think about someone taking CBD, and that CBD literally moving throughout the body, from the brain all the way down to the toes, and looking to see where it is needed. So while it can help with the GABA neurotransmitter and its function in lowering the seizures that patients are having, I also know that patients who are taking CBD can also experience a reduction in inflammation, that their pain can be better. I also know that their bones can heal faster. I know that it has the ability to help with muscle spasms and help with anxiety and other mental health disorders. And so when we think about CBD, I don't want you to ever think about it being able to help with one particular thing. I want you to think about CBD along the lines of being homeostasis, causing homeostasis throughout the body, which is balance, and working on the different parts of our endocannabinoid system that are needing it to help. So throughout our body, Back in the late 1980s, early 1990s, researchers found that every human being has an endocannabinoid system. And it's just a series of organs throughout the body that actually have receptors for CBD. And when we take CBD, good quality CBD, remember that, because not all CBD is the same. But when you take a good quality CBD like Wakana CBD products, you can find that taking it just for pain, for example, may also end up with you feeling better, having more focus the next day, maybe sleeping better at night, having a wonderful, deeper REM sleep. My husband, for example, I always give this example. He started taking the Wakana products for his pain, but it helped his blood pressure. So when I think about Epidiolex and I think about its cost, and I think about the fact that I have some patients who are using Wakana CBD and family members who use Wakana CBD who have had an improvement in their seizure activity, then for me, Wakana definitely is high on my list of choices when dealing with patients who have seizure disorders, and helping them maybe to have to take less of the prescription drugs. Because if they have to take less of the drug, then we have less bone marrow suppression that we have to worry about. We have less of those complications that we have to worry about. So you always want to choose that which is the best for you. And you always want to make sure that you're talking to a doctor that has your best interest at heart. So for those of you who have had issues with seizure disorders, definitely the CBD can be helpful. And I definitely encourage you to have a sit down conversation with your doctors to, see where you can add it in as not as an adjunct, as an addition to what you're already doing, so that you can see for yourself what kind of benefits you can get from it. And with that being said, I'd like to just show you some of the products that we do have available here at Wakana, a whole variety of products. But I always start off with the line with the power products because it allows me to kind of talk to you about the different types of CBD products that we have, how they come in different forms, and what those different forms mean. So first up is our Power Hemp MD, which happens to be our most powerful tincture. The Power Hemp MD is a tincture, it's an oil. You start off with 3 drops under the tongue, let it sit for about a minute or so, and then swallow. Our tinctures typically are going to peak in the body in about an hour, and they are going to last for about 4 hours. Power gummies are up next. Our gummies are different from other gummies in that they are infused with CBD. So every bite of that gummy is through and through going to be infused and filled with CBD. Now, because they are infused, that makes them more potent. And so the recommendation is that you're going to start with these power gummies at only 1/4. And I recommend that you just go ahead and cut them in 4 so that you don't make any mistakes. Well, you start with that 4th, and this is going to peak in your system in about 4 hours, and it'll last for about 8 to 12 hours. Our premium flower up next is a part of the smokable. Now, it is an herb. You can add it to smoothies, you can add it to salads, but it is part of our smokable. And the smokables are the quickest way that we can get CBD into the body. So 2 or 3 puffs, and in 1 minute, you have the CBD peaking in the body, and that lasts about an hour. And then the Power Extreme Pain Cream, which remains my favorite product. You can put this on any area of your body where you're hurting, and it will give you some relief. I have not been failed by this Power Extreme Pain Cream yet. This cream I have put on patients who have plantar fasciitis, knee pain, shoulder pain, you name it, even shingles pain. And they have had some sort of significant relief. Now, you can rub it on and it might work within 5 minutes for some of you, because that's how it worked for my husband initially. Now, the duration has been something that's been quite different for different individuals from what I've seen. I've seen it work all day for some people. I've seen it work maybe for about 8 to 12 hours for others. And then I have some who put it on 3 times a day. But nevertheless, it still remains that one product. I carry this with me still. Everywhere I go, I will have some type of something with this Power Extreme Pain Cream, because you know how it is. No matter where you go, somebody is going to complain about pain. As a matter of fact, the quick story: we went to Jamaica. Wakana treated my husband and I to an all expense paid trip to Jamaica last June, and we went on the Dunn's River Falls. I think that's what it's called, Dunn's River Falls. So you climb up the water. And when my husband was initially getting off of the bus, he put his pain cream on because he knew he was going to be kind of taxing his knee. Well, when we got back to the bus, one of the guys on the bus said, "Hey, what did you put on your knee? Because my knee's been hurting." So the husband talked to him about the pain cream, told him about what happened with him. And of course, I pulled out from my backpack my Power Extreme Pain Cream, and he put it on and he was just amazed. By the time we got to our next spot and he stepped off of that bus and felt better, he was ready to buy it. That's why I like it. I know that I'm going to get some pretty immediate symptom relief from my patients. So when you think about this combination of products, if you are somebody who has a chronic issue going on, especially chronic pain, you want to use all of the products because they have different onsets of action and different durations of action. So let's say, for example, you're having some chronic back pain. You want to have the tincture and the gummy on board. You want to do that twice a day, every day. You want to rub the pain cream on at the same time. And what you know is going to happen is, the pain cream is going to start working in 5 to 15 minutes. The tincture is going to start working at its peak in an hour. And when that tincture is wearing off in 4 hours, the gummies are going to be kicking in, and they're going to last for about 8 to 12 hours. Now, if you're having acute pain, let's say you're having some acute gout pain, that's when you want to have that flower on board, because you need something to get into your system quick, fast, and in a hurry. So doing 2 or 3 puffs of that flower will do exactly that and start to give you some relief. We call that layering. And layering is the best way for you to get the best symptom relief for those things that you have going on that may be more chronic. Now, my husband with the blood pressure, when you're talking about something like high blood pressure, and if you're someone who's using the products, I want you to definitely pay attention to your blood pressure, because I have seen across the board with my patients, anyone who starts using the CBD products, I have had to lower their blood pressure medicine. I have more than several patients who I've had to stop their medicine. My husband hasn't taken blood pressure medicine in over a year now because of the Wakana CBD products. But the tincture and the gummies twice a day will help with things like the blood pressure. But when you're talking about more chronic issues like autoimmune disorders that give you pain, then you want to consider all of the products that you see here right now. Other parts of the smokables include our pre-rolls and our vapes. Again, the smokables get into the system in just 1 minute. Is the quickest way to get CBD into your system. Another reason why you want to think about the pre-rolls, the flower, and the vapes is in situations like anxiety attacks or panic attacks. People who have anxiety and something might have happened, the social anxiety, when you have to go up and do public speaking, your heart starts racing and you're starting to get really nervous and your palms start to sweat. 2 or 3 puffs can actually just I call it bring on the Zen, because before Wakana, I had never puffed anything. But I have to talk a lot with people. I have to do a lot of presentations. I I have to deal with people, and believe it or not, I am an introvert. I could be in my room all the days of my life, and I probably would be pretty happy as long as I have a remote or a book and my computer. So when I do have to get out there and interact more with people, I tend to get nervous. And I had a presentation once, and I was just like, okay, I just need to try this. So couldn't figure out how to do it. It was very comical because I had to call my son in to show me how to do the puffin. And he just was like, I can't believe I'm doing this with my mama. But when I finally got the hang of it, oh my goodness. I mean, literally, I could feel the calm take over from like the top of my head, and I felt it just moving down my body. So people who are suffering with these anxiety issues, with the panic attacks, this is a quick and simple solution for bringing on the calm. We have a wide assortment of gummies. Here you're able to see some additional ones. The first up is the KOJ, which stands for King of the Jungle. Our King of the Jungle is what we use as our main player in our sexual wellness line. This is something that's going to boost your libido, is going to increase your stamina. And this is not something just for kings, it's for queens as well. But when I think about Viagra and Levitra and Cialis and the potential those prescription drugs have in lowering the heart rate so much that it can stop the heart or causing heart attacks, then I feel as though this right here is the safe and effective choice. Because yes, it is very effective. It has been effective for men and for women, as I've said before. And if you cannot deal with worries about your heart stopping, well, of course, you want to stay along that line. Next up, we have the Flight Delta 8 gummies, and we have a caution sign above it. Why? Because it's the closest thing that you can take when it comes to being near the real deal THC. So THC, marijuana, is actually Delta 9 tetrahydrocannabinol. Our Flight Delta 8 is the Delta 8. So it's the closest you get to the real deal without getting to the real deal. So people who have had issues using marijuana products, if you've had side effects, if you've had adverse reactions, then okay, I want to tell you, you might want to just stay away from this. But if you have not, this is such a wonderful product because it gets those wheels turning. It gets you focused. It brings out the creative tools that your brain has been suppressing. I've had so many people tell me that they are finally completing projects that they started. They are actually starting new projects and completing those projects. But another reason I like this product is because it has been the answer to the opioid epidemic for me. So I've been able to successfully transition patients from taking opioids to taking the Delta 8 products. And they have good control of their pain, but not just that, because remember, CBD causes homeostasis. They feel better. They're less achy throughout the body. They're sleeping better. They feel less anxious. This is something that I think is going to be a game changer in the years to come. Prayerfully, it doesn't take years, but we do have an issue with the opioid epidemic. And the problem with the opioids is we take them, they are only supposed to be given for short-term use. And after you've been using them for a few weeks or a few months, the effectiveness wears off, which means you have to go to a higher dose. You do that until the effectiveness wears off again, and then you have to go to a higher dose. Well, at some point, you're going to reach the maximum dose. What do you do then? That's when people start buying on the streets. That's when, if they can't find the opioids, they'll go to heroin, or they'll go to cocaine, or they'll go to other substances. And opioids, there are receptors for opioids in our brainstem where our respiratory center is. And if you take too much of it, that's how accidental deaths happen. And that happens because they've taken stop breathing. So this from moving, but also as an answer to taking opioids, a safe alternative to opioids. I tell you what, you can look high and low, but you will not find literature on anybody who overdosed on CBD. Next up, we have our pure gummies, which if you are someone who has to be subjected to random drug testing, Wakana has done their due diligence in making sure that we do have products for you. So federally, all CBD products can have up to 0.3% THC. But employers, there are still some employers, especially offshore workers. For offshore workers, they are not allowed to even have THC on board. So even though it's only 0.3% THC, the possibility that it can show up is still there. So we don't want anybody getting in trouble. Wakana has done their job in making sure that CBD is available for everybody who wants to use it and needs to use it. So if you're somebody who has to do random drug testing, you want to stick with the pure gummies, where all of the THC possible has been extracted and there is 0.0% THC. Yes, it will still work. I get that question all the time. Well, does that mean it's not going to work? No, that is not what it means. It will work. Now, what I do find is, whereas with the power gummies, you probably only need a fourth twice a day. The pure gummies, you may need a half or a whole twice a day. But that still, I mean, you may take a little bit more of the gummy or a little bit more of the tincture, but yes, it still has the CBD, and the CBD is the cannabinoid that has the great health benefits that we're looking for. And then once again, we have the power gummies, which we went over before. We have a line of culinary products, 3 great, wonderful seasonings that you can add to your foods to give them that extra spice and extra zest that you're looking for. We have infusion oils that you can add to your drinks. And then we also have a CBD butter that you can put on your breads. We have the Power King Chaga. I love this product. It is the only capsule we have. It is CBD that has been combined with the powerful chaga mushroom. So we're talking about anti-inflammatory properties, antibacterial properties, anti-tumor properties. It will boost the immune system, and it also may help in lowering your blood cholesterol and your blood sugar. We have our own line of essential oils as well. And of course, I like to just mention the fact that if it's coming from Wakana, then you know you're going to get the highest quality, highest purity in every single product that we have. If you're not familiar with essential oils, do not sleep on this black seed oil. Y'all, I've never been one who was into essential oils. I have plenty of patients who take them for this, that, and the other. I had not looked into essential oils until I became part of the Wakana family. Oil has done some very amazing things. Antibacterial, antifungal. I've seen it actually help my husband's tooth. He had a bad toothache, and he put the black seed oil on it, and he had relief, even just putting the drops on his tooth. This product itself has some amazing health benefits all on its own. But one thing I do want to point out is that black seed oil actually helps to upregulate beta cells in the pancreas. And so it can help your body to produce more of its own natural insulin and help with treating diabetes. Our sexual wellness line here, the King of the Jungle again, but we also have the G-Spot Lube, we have the Cherry Bliss, we also have the CBD body butter, and we also have something that I don't have on here, but we have a wonderful massage oil now that you can actually implement into your whole sexual wellness experience. sorry, and healthy hair. We have the power, look, power hemp powered hair. This saved my wonderful locks here. Um, had a horrible thing that happened with my family about 3 years ago. I lost my hair all across here. It was so thin. I mean, you could see just scalp in some areas. It was horrible. And I just pretty much comb my hair in such a way that no one could really see it, but or how I thought no one could see it. Because now that my hair is back to being thick and longer, now I'm having so many people to say, oh my goodness, what are you doing with your hair? They want to know about the hair care products because they're like, yeah, I remember it was so brittle and so thin. And I thought I was doing something, y'all. But the SOS hair care system and hemp powered hair to the rescue, putting the drops here on my scalp and rubbing them in helped with the follicles. It helped to relieve inflammation in the follicles, made the follicles healthier so that the follicle could grow longer, stronger, healthier hair. And for guys, those of you who are looking for a healthier beard, we have the beard and scalp oil for you. But combining that with the SOS hair care system, SOS standing for Save Our Strands, because it definitely saved my strands. We have a wonderful hair care system that is designed to make your hair follicles less inflamed, healthier, so that you can grow longer, stronger, healthier hair and get your crown of glory back. This absolutely positively works. And last but not least, we have our phenomenal Flat Belly Lifestyle Program. And I encourage everybody on this call to take the pledge with us. What pledge? The pledge to be healthier, the pledge to reduce inflammation in your body, the pledge to reverse disease processes. And how do we do that? We have 3 different phases. Phase 1 involves weight loss and you eating healthier. And so you're going to get some healthy weight loss there. But I am more interested in disease reversal, which is what you're going to get with phase 2, which is a 7-day raw cleanse, and phase 3, which is a 21-day raw cleanse. So with that raw cleanse, we're talking about using the eliminator, which is down here in red, which is getting rid of mucus and parasites in the body. The regenerator, which is over here to the left in the blue, which is giving us all of the superfood nutrients our body needs, and the purifier, which is going to remove toxins from the body. When we use these supplements, whether you're doing it for 7 days or 21 days, what you're getting is your gut being transitioned from being a leaky, unhealthy gut to a healthy gut, which is where the majority is healthy. Our immune system is going to be boosted up. Our metabolism is going to be boosted up. We have less inflammation in our organs throughout the body, and that is how our disease reversal takes place. So hopefully in every state in the near future, we're going to have some Flat Belly Lifestyle coaches doing bioscans, which uses quantum magnetic physiology in a test that's 1 minute long, and all you have to do is hold on to a probe for that 1 minute. And in that 1 minute, that the quantum magnetic pulses that are going through your hand are interacting with the magnetic fields around your cells, and it can read all the way down to 10 cells and tell you about inflammation in every part of your body. That bioscan is going to give you about 45 different readings, but it allows you to see where you are, and it'll allow you to see things that are going on with you that you are not even aware of. Now, in addition to that, as you see, one of our founding members here, Ms. Phyllis Nash, our chief sales officer, Ms. Phyllis here, she went from being fine to fine, and she continues to do very well. Personally, believe it or not, y'all, I lost 50 pounds. I gained 50 pounds after our tragedy happened. And with the Flat Belly Lifestyle Program, I was able to get them 50 pounds off. The difference, I've lost weight before. I've done Sugar Busters. I've done Atkins. I've done Nutrisystem. I've done all kinds of different things. What I realized is I've lost weight in the past and I did not feel differently. I mean, I felt good that I lost weight, but I really didn't feel differently inside. When I finished this 21-day raw cleanse, literally, I felt like I was clean inside. So I don't have any high blood pressure or diabetes or anything like that. However, I was taking medication that helps me with dealing with what has gone on tragically in our family. But what happened is, once I did the 21-day cleanse, I had to decrease the dose of the medicine. Why? Because my gut was healthier, which meant that it was better at absorbing the nutrients as well as medications through my gut, which meant that I did not have to take as many milligrams as I needed to initially because my gut was now healthy. So take the pledge with me, get in touch with the person who invited you to this presentation. If you are a physician on this call, I know that Dr. Rita is always available to answer questions. I am also available if you would like to contact me to find out more about how I've implemented the Wakana products and the Flat Belly lifestyle in my practice. This has made such a remarkable difference in my practice. I have to say across the board, my patients are healthier. My patients are taking less medication, less prescription medication, and my patients are taking a firsthand front row seat in their health. So this has been quite amazing. I am loving it still. And I'm actually about to start my next 21-day challenge. I'm going to Woman Thou Art Loose next week with TD Jakes. And when I get back, I'm going to do another 21-day challenge because we just came back from Vegas. And yeah, I was eating all kind of foolishness. So I got to get myself back on track. So I hope this was informative for all of you. I am going to stop sharing my screen right now and see if anybody has any questions. So there are no questions in the chat. Let me make sure there are none up here. I hope that means that I was clear. All right. Anybody?
You were
Have any
phenomenal. Thank you, Dr. Kim. I'm not sure if they can put questions in the chat. I think it's still enabled, but maybe the Q&A, they can put those questions there. But I just want to point out how fantastic this information was presented. It was very clear. And I really love the fact that you emphasize that those on the line who may be taking anti-seizure medications, that they really need to be monitored quarterly and not yearly. And two, yes, our products are absolutely an option for a tool to be used in addition to their medication. And three, what I loved is that you really emphasize for them to, whatever condition that you are challenged with, that you loop your physician in, that you have a conversation with your physician about CBD and how CBD, yes, can be used. So thank you so much. I really appreciate that, and look forward to you presenting again in October.
Yes, ma'am. Yes, ma'am. Absolutely, absolutely. So if there are no questions for me, well, thank you, Ms. Diane, for that. I appreciate it. I'm glad you enjoyed the information. If you do have any additional questions, feel free to reach out. My email, you can reach me at jklhealthcare@gmail.com. jklhealthcare@gmail.com. I'll be more than glad to answer any questions you may have. And if there are none right now, I'm going to bid you all a good night. See y'all in October. Well,
Good
if not
night.
before.
Yes.
Awesome job.
Good night, everyone.